And good evening, everyone. Welcome once again to Your Body, Your Health. I'm your host, Paul Ashbrook with Ashbrook Audiology and Hearing Aid Center. Thanks always for tuning in here to BTW 21 for all the great local programming. Have another great show for you this evening. We have with us from Mountain Valley Hospice, right up in Stewart there, it's Connie Casagrande. She is the volunteer coordinator with Mountain Valley Hospice, and she's going to be telling us a little bit about Mountain Valley Hospice, what they do, what they can provide to you and your family in time of need. They're really a very good organization up there, and they want to tell you all about it. So, Connie, appreciate you being here this evening.
Thank you, Paul, for having me. I appreciate it.
You're welcome. Let's kind of start out by just talking about what Mountain Valley Hospice is, when it came to be, and, you know, all the services that you guys provide.
Well, Mountain Valley Hospice is a hospice organization. I forgot how many years it's been in service here, but we were a Hospice of Palliative County in Stewart several years ago, and it was dissolved, and we joined Mountain Valley Hospice, which our corporate office is located in Mount Airy, North Carolina. Mm-hmm. So we've been with them for 2 years. We service 16 counties.
Oh, my goodness.
Between North Carolina and Virginia. So we're a unique company.
So what types of services do you guys provide? When we hear the word hospice, what does that, what would that mean to someone out here watching this?
Hospice means we take care of families, patients and families that are that have a 6 months to live. That is what hospice is.
A diagnosis from a doctor or something.
From a doctor that they have 6 months or less to live.
And have kind of a terminal type of
terminal illness. But we also have a palliative program too, where we have a palliative program where you have respite care for our patients and families that might have longer to live. It's a transitions program.
So it's something that's obviously more than 6 months,
right?
But they may have an issue
that we can take care of them. Mm-hmm. We just have to have the nurses or the family doctor call and talk to the corporation, the company.
Mm-hmm. Now, when we're talking about hospice and hospice care, we mentioned the physician earlier.
Yes.
Would this be something that a physician would have to recommend and or prescribe for a particular patient?
Not necessarily. A family member can call hospice, friends, neighbors, but normally the doctor has to write a prescription for hospice care, that type of stuff.
But obviously you guys work and the staff work very closely with the family's physicians.
Yes, we do. We work very closely with family physicians, doctors, healthcare workers, whoever. We might get a referral from a nursing home for hospice care. So you just never know. Friends, neighbors, pastors, churches, community.
Well, what type of staff do you have that provide these services to folks?
Okay, we have doctors, we have nurses, we have social workers, we have chaplains, we have volunteers, we have volunteer coordinators, we have bereavement counseling, we have a grief group. We also have, now with our volunteers, a prayer shawl ministry that makes prayer shawls for our patients and families, or anybody in the community. These shawls are made by volunteers, and they're prayed over. And then before they go out, they're prayed on again. So that's really a neat service that we have.
So it's really a big team of people that really work together, coordinate together to really help not only the patient coming to this end, working with the family as well to help them through this process.
It is. It's a team effort. It's a team effort.
And you know, sadly enough, we all are going to die someday, some way, somehow. And none of us really want to think about that. But when we know that it's coming, hospice is just a great way to help everybody involved kind of get through this difficult time.
It is, because caregiving is hard work. It really is. And one of the people I forgot to mention was CNAs. We have aides that go out and bathe the patient, maybe feed the patient, that type of service that we go out. So I forgot about them, and they're an intricate part of our organization.
So let's say someone has been, I guess, prescribed to have hospice care. What steps are going to be taken to kind of get this person into the hospice program? Once they're in, what kind of things go on? What happens in the process?
Normally what happens is the doctor will call our office, or the the doctor will speak with the family. You know, the patient has 6 months or less to live. He will tell the family, you know, this is what I think you should take. And he will normally call our office, and the ball gets started from there. We do a referral, we send out a liaison or a admitting team. We have a nurse and social worker that goes out to admit the patient, and they do all the paperwork that's required by the law, Medicare, Medicaid, that type of stuff. And
now, do they study the home and obviously look at the physical needs or physical situation of where this person is going to be having their care?
I'm not sure
done?
if they actually do that on admission, but they will send out another team to go out, the nurse and the social worker, the chaplain, to see what other needs is needed at the time. But the admitting team normally goes out first and admits the team, gets their medicines, take care of the medicines, what they need, and just gets the ball rolling.
Now, obviously, the majority of the staff is a volunteer staff.
No, the staff is paid.
Okay.
The nurses, the doctors, the liaisons, the chaplains. The only thing that's not paid is the volunteers.
And obviously you were telling me you were looking for family volunteers.
I'm
at this
looking
point?
for patient family volunteers to serve in this area right now.
And what would a position like that entail? What would somebody doing that type of work do with families?
Normally a patient family volunteer just goes and sits with the patient while the caregiver goes and does grocery shopping. Maybe goes and gets their hair done. Maybe it's a lady and the man needs to mow his grass. Or sometimes just to lay down and take a nap while somebody's there watching the patient. That is all. A volunteer is not medically trained. We don't give medicines. We don't potty the patient. We don't feed them. What I'm saying
don't
is
do any
feed
of the
them.
caregiving type thing.
Caregiving type stuff, that type of stuff. We're just mainly there to sit with the patient a couple hours, once a week possibly, so the caregiver can get out and do some errands or just whatever they need to do. It's just a break for the caregiver.
Obviously, the need for hospice care, and then on top of that, people to help provide the services, including volunteers.
Yes.
That demand is growing quite a bit here in this area.
It is growing. We have a number of patients we're serving in Henry County, in Martinsville area, and it's grown so much that we're needing volunteers to grow also. So, you know, I'm here to ask for anybody who would like to volunteer, that we have a volunteer training coming up, November the 12th and the 19th. It's 2 Saturdays. It's from 8:30 to 5. And we serve food. We serve breakfast and lunch, and I do a lot of the cooking, so it's good. You can. I have references if you need that. The training is free.
Right.
The only requirements is a valid driver's license, an automobile, no criminal history, and a willingness to serve family and friends in this area.
And so how can they get in touch with you guys to become part of this particular program?
They do have to fill out an application, but all they need to do is give me a call at 276-694-4416 or an 800 number, which is 1-888-974-4416. And they just need to call and talk to me about it. Or if there's a church, a community group, Ruerton's Rotary, if they'd like me to come out and give more information about this, that's all that's required. But we're just looking for men and women. Men, it's very hard to get men to do this, but we do have a few men in our organization. They're wonderful. I need more, more men. If I can clone some, to
Right.
go out and do it. And it's wonderful. It is wonderful what they provide for the patient and family. Caregiving is, I can't say enough, it is hard work. It is just such hard work taking care of somebody and knowing it's their end.
Well, let's take our commercial break, and when we come back, we're going to talk about kind of some of the courses or what someone would be learning at this training that you're going to be doing here for volunteers. So stay tuned. We're going to be back here in just a moment.
If this were a lump in your breast, it could be cancer, and you wouldn't be able to feel it, from inside or out. But there's a new technology that sees cancerous lumps at their earliest, most curable stages and can be up to 28% more accurate. It's technology that's helping save women's lives. It's called digital mammography. And we're the first in the region to offer both digital mammography and breast MRI. Call Memorial Hospital to schedule your mammogram. Visit our website to learn more at martinsvillehospital.com.
Want the real proof you're saving money on a used car? Get proof pricing now at Nelson Ford.
Pricing that makes sense.
We research used car prices from all competitors, then price ours for less.
Always looking for the best price.
It's ridiculous to pay more when you don't have to.
Proof pricing ensures you get the right vehicle at the right price. And now, buy any Nelson used vehicle and get your first service free.
Here at Nelson, we can prove we got the lowest price.
Nelson Ford, 201 Commonwealth Boulevard. Everybody knows cars cost less in Martinsville.
When you lose your hearing, you lose your connection to family and friends.
We're not here to celebrate your advanced age. We're here to celebrate your advanced wisdom.
You miss out.
He's always teasing us, but we love him.
Got me a big bowl of dog food and told me it was...
You lose your place. At Oticon, we understand. As a leader in advanced hearing care for over 100 years, we can help. With Agile by Oticon. Agile is the revolutionary new hearing device that helps you hear more naturally, clearly, directionally, discreetly. Experience Agile for yourself, risk-free. Call this number. In just a few minutes, you will learn how Agile can transform the way you live your life and help you return to the person you want to be, the person others know you are. Agile by Oticon. Reconnect with your family, your friends, yourself.
You're watching your neighborhood network, the pride of Martinsville.
There are many reasons to choose Monroe Muffler Brake and Service for all of your car's maintenance, repair, and tire needs. We work on your schedule with convenient evening, Saturday, and even Sunday hours. We've earned our customers' trust with over 50 years of guaranteed quality service. And one more popular reason is Monroe's oil change and more for only $19.99. Plus, we'll rotate your tires, check tire pressure, and inspect your brakes for free. Trust Monroe to keep your car and your family safe. For dealer quality service for less, it's Monroe Muffler Brake and Service.
At Southern Virginia Properties, you will receive friendly, reliable service for all your real estate needs.
Southern Virginia Properties helped us find our house. I'd encourage anyone who is serious about finding and buying a house in this market to contact Southern Virginia Properties.
I give all the credit in the world to Southern Virginia Properties. They really are dedicated to the work that they do, and they're dedicated to the community that they serve.
Thank you.
Daniel's Auto Glass, the mobile unit that comes to you. No job is too large or too small. Quick, easy, and affordable. Call Daniel's Auto Glass at 1-800-656-9488. Commercial, residential, and vehicle. The mobile unit is just a call away. Offices located in Oak Level across from Lucky 2 Market on 220. Daniel's Auto Glass, when only the best will do.
And welcome back to the program. Glad you stuck around. We're talking with Connie Casagrande. I love that, Casagrande. A volunteer coordinator. She's with Mountain Valley Hospice, located in Stewart. And we've been talking about Mountain Valley Hospice, and they've been looking for patient family volunteers. And they've got a big volunteer course coming up in November. So they're looking for volunteers to kind of come into the program and work with families. And there's, a little bit of training involved, but they, for a couple of Saturdays, you can get trained and be able to help a lot of good people. So
yes, you can get trained and fed.
Fed, that's right.
Fed,
Home
yes.
cooked food.
Home cooked food, yes, we do that.
And we're looking at November 12th and 19th as the dates
Saturdays.
of these particular trainings.
Yes,
it's two Saturdays.
It's 2 Saturdays.
That's all, just 2 Saturdays.
Just 2 Saturdays for training is all, and the training is free. Like I said, we only require a valid driver's license, an automobile, no criminal history, and a willingness to serve family and friends in your area.
And the thing there is, what kind of topics are going to be discussed, during the training that goes on?
Well, we discuss each discipline. What I mean is each discipline of our team comes in and discusses what they do. Like a nurse will discuss what she does with the patient. The chaplain will discuss what he does. The bereavement team will discuss how they work with the family to be prepared for the death that's coming. The social worker, they discuss what they do in helping the family, maybe finding maybe some food stamps or getting them extra help that they might need. The doctor, he comes in and talks. We have
so it's just kind of building that team so that the
building
volunteer understands what all the other members of the team are actually doing.
That is correct.
So that they're not...
right, so they're not scared to death when they go out to see the patient family. So that's what it is. One of the things I would like to discuss is what makes Mountain Valley Hospice unique. We serve now North Carolina and Virginia, which allows us to take care of patients in either state. Like if you had a family member in North Carolina and they were sick under hospice care and you had to move them to Virginia, that service won't stop because we're licensed in both states.
Hey, you were saying 16 counties
16
you guys
counties
cover.
in Virginia and North Carolina, yes. Out of our office, we cover Padre County, Henry County, Floyd, and Franklin. And I could tell where our office is located.
Sure.
We're located at 22099 Jeb Stewart Highway in Stewart, but it's actually in Patrick Springs.
Patrick Springs, right.
We're actually in Patrick Springs, right where the sign says come down to 45 miles an hour. We're right beside what used to be BB&T Bank in Patrick Springs. So it's not hard to miss, especially when it says slow down to 45. We're just past the 45 mile an hour sign. And it's big office, has a big sign out front.
And generally the office is a training area, staff area.
Staff area. We open from 8 to 5 every day, and we have 24-hour on-call service. So if the patient gets sick, you call our number, it goes into a call service. They turn into another team of nurses, which give you information. Then they in turn call nurses to come out and help you, whatever's going on.
I know I can speak from firsthand experience in working with hospice to a degree. Just recently, my grandmother fell ill.
Yes.
She was 89, and she had a heart attack. It was a pretty big heart attack,
right.
And they got her to the hospital, and the doctors kind of told all of us that we've got a lot of damage here, and we're looking at her not going back home.
Right.
And so it was a very touchy situation for her two sons, my father and my uncle, to work with this. And one of the things that finally came about out of it was looking at hospice care.
Yes.
And for the last week of her life, she was in hospice care, and they were just wonderful. It was amazing the support that the team of people have that come in and work with her and work with my father and his brother and my mother and all the family that kind of came in and out. It was really nice. We all got to actually say our goodbyes, and it was very supportive. And Granny, as I call her, she was still with us. She was still mentally was still there, and just physically, her body was just kind of getting ready to go, but she was still there and could talk to us right up to the end, and it was a nice way to go.
It is.
It really was.
It gives you a goodbye, and we teach you what the steps are when it comes to that time. It really does. We have a bereavement team that will train you. This is what happens. This is the steps and that come in death. It's a good goodbye.
And I guess it kind of made me think to a degree in terms of how would I like to go?
Right.
When my time comes, whenever that is,
right.
How would I like to go? And I don't know of anyone who would not like to go in a manner that hospice is able to help provide and facilitate, not only for the patient, but for the family as well. It's a wonderful situation, and I just hope that more people wouldn't be so kind of, I guess, leery of it and uncertain about it, because it really is a beautiful thing.
A lot of people, when they hear hospice, oh no, it's the end. But it's not necessarily. Sometimes we have gotten patients' medicine straightened out and they're discharged. They get better, but you just never know. And a lot of people think the myth is, well, it can only be cancer. It's not cancer anymore. It's cancer, COPD. I can't even think of all the diseases. Could be a bad case of diabetes, heart disease, lung disease, liver cancer, liver disease, just different diseases. But there's a criteria, and the doctors have little handouts that we've given doctors, and okay, this is what this patient can have. Oh yeah, I didn't realize they could do this if they're to have hospice, but it's just about people taking care of people. It's not about the quantity of your life, it's about the quality. It's about the quality. It's a quality of your life, and what quality do you want at the end of time? It's in your life. And what do you want for your patient family?
And it is. It's a beautiful thing. I mean, until you've been a part of it, until you've had to experience it and understand how wonderfully done it is, and how wonderful it makes the whole process of healing really happen a lot quicker. Because it's been such a nice way for it to happen.
And then we have a bereavement team that comes in after the patient dies and helps the family. We have we have grief groups that meet in Stewart. I think it's the third Wednesday of every month at Stewart United Methodist Church. If I remember right, it starts at 1:30, but you can call our office to find out. We have...
And the bereavement team will work with the family for a period of time,
13 months. We work with the family 13 months. Some people don't want it for like that long, and some people are in it for longer than that. You just never know. And there's different teams. We do have some people that's been in our grief camp that might go to Stewart's grief. They might go to Manery's grief. They might go to Hillsville's grief. You know, they just might make the rounds and just meeting with different people in their grief. We have a grief camp. That's every summer that for children, because children grieve differently from adults.
Sure, certainly.
And we have a team that works with that, and that's a wonderful program. We also have a celebration of life every year. That's held at our memory garden. That's one thing we have in Stewart is a memory garden, and we sell bricks once a year. Well, it's ongoing from like April to May of the next year, and then we have a celebration of life, and we honor those people with those bricks. And it's just beautiful there at DeHart Park in Stewart. It's not hard to find. It's near the Palliative Community College in Stewart, and everybody just loves it there. We've actually had 2 weddings.
Oh, wow.
We've had a christening. It's just wonderful. We have volunteers that take care of that. And that's an ongoing project, too. So it's just beautiful there. You just need to come up.
Well, obviously, all the things that Mountain Valley Hospice is doing and been providing for folks in our area is wonderful stuff. They are desperately looking for patient family volunteers, and they have a course coming up in November. Again, if you want to contact them and find out more information about it, the number is 276-694-4416, and I believe Doug's had that up on the screen for us. Doug's always great and efficient at that. We certainly appreciate him back there behind the scenes doing all that.
And then we have a prayer shawl ministry that meets the second Tuesday of every month from 10 to 12, and they can come in and learn how to crochet or knit prayer shawls or hats, or we've made pillows, or we've made little neck pillows for our patients, and they can come in and learn how to do that. And we actually provide the yarn for them.
So there's all kinds of great activities that you guys have going on.
We have a Pet Peace of Mind project where if you have a pet, we can get you some dog food, we can get your pet vaccinated or shots. Some Palliative medicine. We honor veterans program. That's a new program we have.
But you know, the pets is kind of interesting too, because pets is kind of the unforgotten subject matter in situations like this.
But that means a lot
pets,
to them.
Especially dogs and cats, can really feel what's going on in an environment. They know. They do. They really have a great sense. And there's not enough kind of helping those guys out either. So that's great too.
And then we also have a hospice home in Dobson, North Carolina that several patients from this area have actually been to and had their last days there.
Wow.
And family members can stay there. Sometimes this is a respite for the family because they just give out. And they get 24-hour care there. And we actually have a Pet Peace of Mind project where animals will come in and see the pets.
Oh, wow.
So that's been real neat, too. So it's sometimes we just go to Dobson to the Joan and Howard Waltz Hospice Home. It's a beautiful facility.
Well, I know if anybody out there wants more information, again, just give Connie or any of the folks a call there at Mountain Valley Hospice. Again, the number is 276-694-4416. And Connie, we want to thank you for coming down this
thank
evening
you. I
and
appreciate it.
spending time with us here, and I hope you get lots of volunteers.
I hope so too.
And again, just give them a call. They'd be more than glad to help you out. Our pet of the week from the SPCA, a beautiful cat. This is Odessa. She's a 4-year-old spayed gray domestic, and she would love a great home. So if you are a family who's looking for a nice pet, go to the SPCA, look at Odessa and all the other great animals that are available for adoption right there in Martinsville. We want to thank all of you for tuning in here to BTW 21. Thanks for staying and keeping your channel right here on the Neighborhood Network. We certainly appreciate it. In the meantime, I want all of you out there to take care, and we will talk to you again real soon.
If this were a lump in your breast, it could be cancer, and you wouldn't be able to feel it, from inside or out. But there's a new technology that sees cancerous lumps at their earliest, most curable stages and can be up to 28% more accurate. It's technology that's helping save women's lives. It's called digital mammography. And we're the first in the region to offer both digital mammography and breast MRI. Call Memorial Hospital to schedule your mammogram. Visit our website to learn more at martinsvillehospital.com.
Quality home care is a team effort, and Team Nurse has a complete range of personal care providers. Your state-licensed nurse aide makes daily living more comfortable, and regular visits by a registered nurse ensures the best possible care. Team Nurse has 14 area offices providing in-home personal care, ranging from companion care to skilled care, and we're on call 24/7. Visit teamnurse.com or call for your in-home care assessment.
I recommend Team Nurse.
You're watching your Neighborhood Network, the pride of Martinsville.
For over 80 years, Martinsville First Savings Bank has called Martinsville home. In this time, we've gotten to know our customers personally. Our interest is in Martinsville, in the people and businesses of Martinsville. And because we're a part of the community ourselves, we have a stake in the people around us.
Though we've changed our name, our goal is the same, to always put Martinsville first.
This is a Shark Tale.
Here we go again.
2004 phenomenal hit.
You're watching your Neighborhood Network, the pride of Martinsville.
Nelson Toyota introduces proof pricing on all used vehicles. Real proof that you're saving money.
Saving every penny counts.
We research used car prices from all competitors, then price ours for less.
Saving money means a lot to me.
Price matters to me and my family.
Proof pricing, because knowing is better than guessing. And now, buy any Nelson used vehicle and get your first service free.
Here at Nelson, we can prove we got the lowest prices.
Nelson Toyota, 980 Ferrystone Park Highway. Everybody knows cars cost less in Martinsville.
Shavli Electric, a trusted name for over 34 years. For prompt, professional, and friendly service, call their Martinsville office at 638-2600.
Get out of the stands and into the pits with Patrick Henry Community College's Motorsports degree program. Gain valuable hands-on experience with the same equipment used by the top race teams in the industry. Learn from instructors with nearly 100 years of combined racing experience.
Patrick Henry Community College. It's a great way to get started in racing.
Visit our website to learn more about the most exciting motorsports degree program in Virginia. Get out of the stands and into the pits.